So it is technically July 29th because it's early in the morning, but 28th, whatever, I had my consultation technically yesterday um, with, or not my consultation, sorry, my pre-op appointment with Dr. Hugh McLean, McLean Clinic, Mississauga, Ontario. So basically, I was going in for my pre-op appointment. I was going in to pay the rest of the balance for surgery, and I had to do another mini consultation with Dr. McLean because my initial consultation was a little over a year ago. It was on July 8th. So they wanted me to see him again briefly just to make sure everything was crystal clear and we were all on the right track for where we were going with this. And yeah, so I showed up. My appointment was for 4:45 p.m. I got in, I got in at like 4:30, and then I sat in the waiting room for a bit, and then they called me in to meet with a lady whose name I don't know, and I'm not really sure what she does there. Like I know they told me, or she introduced herself to me like a year ago when I was there, and she told me what she did, but she didn't tell me this time, so I'm not really sure. I don't remember what her name was and everything. But anyway, she went over um, the package that they emailed to me when I picked my surgery date. They email a package to you. It's all of the consent forms and everything. You have to read them over before you go because it's a lot of pages, and you're not going to have time to read them all over while you're there. So they email it to you, or they can mail it to you if you prefer that, and you can read it all over. And then when you get there and actually get the actual copy of it, then you sign that copy and everything several times, and yeah, sign and initial several different pages and spots. There's a photo consent form where they take the pictures of your chest, pre and post op, possibly posted on the website. They do whatever they want with the photos, basic photo release form, and like surgery consent form, and all of the stuff saying, I understand there's risk, I understand all of these different things can happen, and everything like that. So signed that. She went over just went over a little bit more about the procedure. Nothing in too much detail, nothing I didn't already know. Asked me if I had any questions for her. I said, my mom wanted to know, once they take me home, if there is any problems, who are we contacting? And she said, we give you a number to call. Don't go to the hospital because they won't. The waiting times will be ridiculous, and they won't really know what to do with you because they don't know what kind of procedure you've had or anything. So she said they give you a number, or yeah, they'll give me a number to call if we're having any difficulties. And I didn't really have any questions for her, so she then took me into the next room where they have the blue wall behind where they take the pictures. So I had to take my shirt off and everything and my binder off and took the pictures of my chest. And then since I had to do a reconsultation, a mini one with Dr. McLean, she just said, okay, keep your shirt off and he'll come in. So he came in and touched my chest a little bit more, and he confirmed that I'm getting double incision because my skin is very droopy. Doesn't have enough elasticity. And then he asked if I had any questions for him, and I said, I was asking about my nipples. That was really the only question I had was the sizing of my nipples. So my nipples are tiny. And he was showing me the amount they usually take off of people's, and it's like bigger than my nipples are. So I told him I want a little bit off. I said, I know my nipples are really small. I would like them to be a little bit smaller. And so he made a note of that in my file there, so that on the surgery date he can deal with that. And he said people will bring in like buttons and stuff, like a button of the size that they would like. And I just said I don't think I don't think I need anything specific. I just would like you to take off a little bit of what I've got. And he said, yeah, that's fine. And that was really the only question I had. And then they gave me the prescription for Tylenol 3, so painkiller, and then also it's like Zofran or Zofran, or something, and it's a little tablet. They said you bring the tablet on the surgery date and you take it right before surgery. The nurse will give it to me and I'll take it before surgery. And it's an anti-nausea pill, a long-term anti-nausea. And then they said, and then he was done with me after he gave me the prescription. Sent me to see Liz, who's the finance manager, whatever. And so I gave her the check for the rest of the balance, which was, so I went and made the down payment, which is 10%. I made that a couple months ago, and it was $791. So my remaining balance was $7,119, and so I paid that last chunk of money, or the rest of the money, I should say, today. And this is my invoice. I'm not going to show you because it's got all my information on it, but yeah. So the remaining balance was $7,119. I paid that today by check, and then she went over. Liz went over with me, what's going to happen on the surgery date. So my surgery is at 9 a.m. Or sorry, I have to be there for 9 a.m. My pre-op prep shit is at 9. And then there's someone in the hallway. Surgery at 10 until 12-ish, and then she said I'll be in the post-op room and they will wheel me down in a wheelchair around 2:30 to my car, like my dad's car, and help me get into the car, and then I'm off for the day. So I'll be out around 2:30. So my day starts at 9. I'll be at the clinic, and I'll leave around 2:30. They said so, and then I have to go back the next day, and then I have to go back again 8 to 10 days later to get off the nipple sponges and crap. But basically, that was everything that happened. I got out at about 6 o'clock, so I got in there at 4:30 and got out at like 6. So hour and a half for my pre-op plus mini consultation and paying the rest of the balance. So I'm having surgery on August 13th, so that's 2 weeks and 2 days away. I'm really excited at this point. I am so excited. I was sitting in the chair waiting for the lady, because she leaves the room so you can undress. And there's a giant mirror there in the room where you take the pictures. And I was just sitting there and I was shirtless and I was looking at myself and just thinking, like, 2 weeks this is going to be gone, and I'm so excited for it. I just can't wait. So yeah, that's basically it. I just wanted to let you guys know everything that happened at the pre-op appointment, in case you're going to McLean and you want to know. If you have any questions at all, please don't hesitate to ask. If you have anything you want me to talk about, again, don't hesitate to tell me. So yeah, I'll keep you guys updated, and thank you for watching.